We often view the placebo effect through the lens of this solitary figure, a psychological trick where thinking yourself better produces a vague, subjective sense of improvement despite an empty treatment. But clinical data tells a different story. Placebo responses are specific, objective transformations in the body. They involve measurable changes in neurotransmitters, neural activation patterns, and immune function. And this biological reality completely changes the conversation. It suggests the human body possesses the capacity to alter its own chemistry based entirely on an expected outcome. In the nervous system, a placebo can trigger the release of endogenous opioids to kill pain. We know this is a physical event because when researchers administer an opioid blocking drug like naloxone, the placebo effect stops. The empty pill engages the same chemical pathway as a pharmaceutical painkiller. When we pull focus to the brain's striatum, the effect is even more striking. In patients with Parkinson's disease, a placebo treatment can trigger a massive release of dopamine, often in quantities comparable to a therapeutic dose of medication. And as we zoom out to the bloodstream, we see the effect reach the immune system. Placebo responses can drop T-cell production and interleukin-2 levels, suppressing immune markers without any active drug present. If the brain is a machine driven strictly by chemistry, we have to explain what initiates these massive physiological cascades when the physical pill itself is empty. The scientific anomaly is that the physical outcome depends entirely on what the patient believes. Consider this decision tree. Told a sugar pill is a painkiller, the nervous system follows the downward pathway, generating chemical markers for pain relief. Told it's a stimulant, it traces a new line upward, heart rate and blood pressure increase. Mechanical brain chemistry alone struggles to explain why identical physical inputs, like a sugar pill, trigger opposite biological results. This suggests that abstract meaning is actively directing cellular traffic, directly challenging the view of consciousness as a passive byproduct. The scientific complexity deepens with open-label placebos, where patients improve even when they know the pill they are taking contains no medicine. Here, the healing agent isn't a false belief, but participating in a therapeutic ritual. The response originates from within the person's engagement. Choosing to trust a practitioner, hoping for relief, committing to the physical act are forms of deep cognitive processing. Biological healing operates as an integrated response to the mind's active engagement with context and meaning. Beyond the clinical setting, the placebo effect provides visible evidence for mental causation. In a strictly closed physical system, an abstract thought about a pill could not dictate which specific neurotransmitter the brain chooses to release. This loop shows how human conditioning relies on conscious expectation. The body responds to cues because the mind anticipates a result, a connection that strengthens and reshapes over time. Sustained mental activity eventually translates into structural change, using these pathways to reshape the physical brain and body. When a conscious expectation determines whether a brain releases an opioid or a stimulant, the abstract meaning of a thought is performing causal work. This reveals consciousness as a participant in the physical world, shaping biological outcomes through the specific content of its beliefs.